I'm Dr. Jim Harvey. I am a family practice physician with Privia Medical Group of North Texas in Fort Worth. I got started in clinical research almost 30 years ago in my residency and have been at it off and on since then. Took a long break from it and then ended up back in it about 3 years ago. And I really enjoy learning. And I also found that being involved in research helped me help my patients. And I have been with Javara for the last 2.5 years. I decided to become an investigator because my mentor in my residency exposed me to clinical research. And I saw it as an opportunity to work towards helping my patients and learn how to do research. This is heart work. Not hard work with a D, heart work. H-E-A-R-T. If you genuinely want to try to find the best and the latest opportunities for your patients, then clinical research can give you an opportunity to provide access to treatments that they don't already have and that you don't have access to. Javara has done a lot of things to help my research experience. They have provided the training necessary to have a foundation to be able to participate in research trials, and their contracting work makes it a whole lot easier for me because I don't have to address all the details that come from that. And by providing me with staff, CTNs, to do that research work, my staff has not had to learn new skills or do things that take them away from their primary work of taking care of my clinical patients. If your schedule is already full, finding room for research patients can be really easy or really hard. And by that I mean that the Javara staff, with their work that they do to really narrow down what I need to do to just the clinical tasks, makes it a whole lot easier to see those patients in the gaps during the day with regular clinical patients. Now, when there are studies that are enrolling at a much faster rate, where there are a lot more patients to address, that then usually requires that there be some adjustments to the regular clinical schedule to make sure there's enough room to take care of the research patients. But it certainly makes it a lot easier when the staff is taking care of all of those other issues. Because as physicians and providers, examining patients and determining medical things is a fairly quick part of the process. It's the talking to the patients and covering all the administrative details that takes up a lot of the time. So it makes it a lot easier to do both in the same day. As a family physician, I'd love to know what an average day looks like. On a typical day, it is maybe 10 to 15% of a day when we're bringing research patients in that's spent on the research patients, and the other 80 to 90% of my day is spent with regular clinical patients. And sometimes on really high enrolling studies, we elect to run a Saturday research clinic. For patients, participating in research can be confusing and a little bit unsettling. And it's really important for them to understand that Javara, as our research facilitator, as our research partner, is going to be reaching out to them, especially if it's a patient that we've identified for a new trial that we haven't been working with. To help with that, we have posters up in the clinic with Javara's name and explaining who Javara is. And if they're a patient that's eligible for a trial, we usually try to call them, if it's one of my patients, before Javara does, to let them know, hey, these folks are going to call you. And when they do, it's okay to take the call. They're calling on my behalf. That training is fairly intensive and it requires some time. The nice thing about working with a partner, and in this case for me it was Javara, is they packaged that up into videos that I could do on my own time. And they also had opportunities to work with some of their senior research staff to get that training and to understand that training. Because a lot of times as you're reading through this stuff, it's different than regular clinical practice, and it's sometimes hard to sort of differentiate in your mind, what is it I'm supposed to be doing over here, because this is different than how we do things in regular clinical practice. And so as we got closer to a study that was coming up and there was training that needed to be completed for that foundational work, we spent about 5 hours on a Saturday completing some training that would have taken me probably 10 or 12 hours on my own to do. So they made it much more efficient. And I'm not gonna sugarcoat it. It takes a fair amount of time to do this training. It can take 10 to 20 hours to do all of this foundational training. And that's time that you just have to spend listening to the videos, reading the work, taking the quizzes, because you have to prove that you have an understanding of this information to get the certification to be able to participate in these. But it is a whole lot easier to do that with somebody who has packaged the content to make it easier for you to get through. For me, the biggest benefit is the enjoyment that I get out of helping patients who participate in the research to be exposed to new and different opportunities for managing illnesses that they have, where in a lot of cases there may not be a good treatment. Obviously, there is a financial incentive for being in research because it is work that you get paid for doing. But really, money is not at the heart of doing research. It is that idea of expanding the knowledge base that's out there and providing treatments to patients, like the situation with my late wife, where there was no good alternative, and having exposure to an alternative to give people a chance at a better quality of life. The power that comes from being a part of that, for me, is at the core of why I do research. It's easy sometimes in research to get sort of into a cycle of just doing the work, but it's always good every now and then to just step back and think about, these are real people with real problems, that for some of them, this is the first real opportunity at a better quality that they've had in quite some time. And to me, that's what matters about research. I think the biggest tip that I can give you is trying to do this on your own is almost impossible. If you're interested in doing research, you need to find a partner. Having Javara as my partner, I get 3 or 4, hey, what do you think about this trial, emails a week. And if you're serious about doing research, you have to know which trials are out there to be able to figure out which ones do you want to participate in. And so having that partner just to get you to the point of being able to do the research is absolutely key. And then once you land a trial and you have to execute on it, having that partner so that you're not having to make your staff do the work, so that there's somebody who does this and knows what they're doing, makes it a whole lot simpler and easier to execute on than trying to do it by yourself.